please announce where you are attending remotely from. So Ray, will you please call the roll?
Commissioner Beeman,
Present, attending remotely from the village of Manchester, Washtenaw County, Michigan.
Commissioner Hodge,
Present, attending remotely from Ypsilanti Township, Washtenaw County, Michigan.
Commissioner Jefferson,
Present, attending remotely from the township of Ypsilanti, Washtenaw County, Michigan.
Commissioner Labar,
Present, attending remotely from the city of Ann Arbor, Washtenaw County, Michigan.
Commissioner Maciejewski,
Present, attending remotely from Dexter Township, Washtenaw County, Michigan.
Commissioner Morgan,
Present, attending remotely from the city of Ann Arbor, Washtenaw County, Michigan.
Commissioner Sanders,
Present, attending remotely from Pittsfield Township, Washtenaw County, Michigan.
Commissioner Scott,
Present, attending remotely from the city of Ann Arbor, Washtenaw County, in the great state of Michigan.
and Commissioner Schenk.
Present, attending remotely from Northfield Township, Michigan.
Thank you. We have a quorum. We'll now move on to citizen participation, and this is the portion of the meeting where members of the public may address the Board of Commissioners. If you're participating in public comment, please announce your name and residence, and keep in mind that you're limited to 5 minutes here at the working session. As our meeting is remote, please use the raise your hand feature in Zoom, and we will ask individuals to speak in the order that their hand was raised. If you're participating by phone, please press *9 to raise your hand. So I'm going to check to see if any of the members of the public in attendance have any public comments. At this point, I am seeing none. So I believe that with no public comment, we will move past commissioner follow-up to public comment and on to the county administrator's report.
Thank you, Chair. I have no report this evening. I will say that I'll be turning my camera on and off. I apologize. I have a weak connection this evening.
All right, thanks for the notice. Moving on to our discussion item for the evening, we are joined by Jimena Lovelock, who is going to present an update on her public health proposal. So I'm going to turn the meeting over to Jimena. Thank you for joining us tonight. And we look forward to hearing your presentation. Thank you.
Thank you so much, and good evening, commissioners. Happy to be with you this evening to talk about investment in public health and public health services. Before I start, I just wanted to share a brief statement that I wanted to read for all of you. I want to thank the Board of Commissioners for passing 2 resolutions recognizing Hispanic Heritage Month and honoring Hispanic and Latinx organizers for their continued participation and partnership in expanding COVID-19 vaccine access for Spanish-speaking residents in Washtenaw County. As a person of Chilean background and with family still living in Chile, I appreciate the recognition of Chile's Independence Day, along with other significant anniversaries of independence for Costa Rica, El Salvador, Guatemala, Honduras, Nicaragua, and Mexico. I also want to extend my personal thanks to Spring Quiñones, Maria Militzer, and everyone that is part of Mexiquenses in Michigan for their partnership with the health department and the county to ensure that nearly 3,000 Hispanic residents have received at least 1 dose of COVID-19 vaccine. We would not have achieved that without their commitment to health equity and ongoing partnership. I would also like to take this opportunity to acknowledge the tireless work of our medical director, Dr. Juan Marquez. Dr. Marquez acts as medical director for both Washtenaw and Livingston counties and has been instrumental in shaping COVID-19 response strategies within the county, including advising universities, schools, businesses, and other organizations, and working in close coordination with our health systems. In addition, he regularly helps at community pop-up testing events, vaccination clinics, and community education events in English and Spanish. We are fortunate to have these and other Latinx leaders in our county. And now I would like to read that in Spanish. Quiero agradecer a la Junta de Comisionados del Condado de Washtenaw por aprobar 2 resoluciones en reconocimiento del mes de la herencia hispana y para honrar a las organizaciones hispanas y latinos por su constante contribución a expandir la vacuna de COVID-19 a la comunidad que habla español del condado de Washtenaw. Como una persona de ascendencia chilena y con familia que reside en Chile, aprecio el reconocimiento del Día de la Independencia de Chile junto con otros aniversarios de independencia para México, Costa Rica, Guatemala, Honduras y Nicaragua. También quiero expresar mis personales agradecimientos a Spring Quiñones, María Militzer y a todos los que son parte de Mexiquenses en Michigan por su cooperación con el Departamento de Salud y el condado para asegurar que casi 3,000 residentes hispánicos hayan recibido por lo menos una dosis de la vacuna para COVID-19. No podríamos haber logrado eso sin el extraordinario compromiso de ellos en su lucha por la igualdad en la salud y su colaboración con el Departamento de Salud. Quiero también aprovechar esta oportunidad para reconocer la incansable labor de nuestro director médico, el doctor Juan Márquez. El trabajo del doctor Márquez para los condados de Washtenaw y Livingston ha sido fundamental en dar forma a las respuestas al virus COVID-19, aconsejando universidades, colegios, negocios y otras organizaciones. Además, él ayuda regularmente con las clínicas de pruebas de la detección del virus, como también con las clínicas de vacunación y con educación en la comunidad, ya sea en inglés o en español. Somos muy afortunados de contar con estos extraordinarios líderes de la comunidad hispana en nuestro condado. Thank you. And now I will share my screen so we can get started with the presentation. Let me just give me 1 second here to share. Go. Okay, can everyone see that? Okay, wonderful. Well, again, thank you very much. Happy to be with you this evening. And really thank you for providing me an opportunity to share this proposal for public health investment with you tonight. As we continue to respond to the COVID-19 pandemic, strengthening public health must be a priority for our county. So tonight I'll be talking with you about the Healthy Together proposal. It really has clearly a public health focus, and most importantly, on the potential impacts that additional public health investments can have in our county. We know that we have seen a disproportionate impact of COVID-19 among communities of color and in certain areas of our county, particularly on the eastern side of the county. And we need to continue to respond, but also focus on how to recover and how to improve the overall health of people that are most vulnerable to COVID as well as other chronic conditions. In addition, we at the Health Department, through the Board of Health, as well as you as Board of Commissioners, passed a resolution declaring racism a public health crisis. And that resolution means that the work of county departments, especially the Health Department and the Racial Equity Office, will continue to be done intentionally and with the goal of ridding our county and county government operations of these inequities, and that to address this crisis, the Board of Commissioners has a responsibility to enact policy that shall include increasing the budget for the Health Department, among other actions. So in this proposal for public health investments through the Washtenaw Rescue Plan, we focus on centering equity and particularly using data to help drive our initiatives and our services and our work around policy development, looking at the tools that are available to us, like the Opportunity Index and the Social Vulnerability Index. We also will focus on engagement and partnership throughout this process. The health department has a long-standing commitment to health equity and working through community engagement to address health inequities. And that is a critical part of this proposal and will continue throughout the work that we do. And of course, we're looking at focusing on multiple levels. In public health, we focus on population health, but we recognize that our services impact individuals, neighborhoods, communities, and environment, and that will continue to be our focus. And as I mentioned, we want to emphasize that our public health impact is driven by data. So just as a context and reminder, I've talked about this before, but just to revisit the essential public health services and what we focus on as our role as a local health department. And these are really broken down into 3 areas. So one is assessment, one is assurance, and also policy development. And at the center of all of it is equity. And to achieve equity, these essential public health services promote policies, systems, and overall community conditions that enable optimal health and seek to remove systemic and structural barriers that have resulted in health inequities. Those barriers include poverty, racism, gender discrimination, ableism, and other forms of oppression. So as we look around this wheel, I just want to highlight a few examples from each area. And this is work that we do on a regular basis at the health department. Under assessment, we assess and monitor population health status, factors that influence health, and community needs and assets. As assurance, we assure that there's an effective system that enables equitable access to the individual services and care that are needed to be healthy. We also work to build and support a diverse and skilled public health workforce. In policy, we strengthen, support, and mobilize communities and partnerships to improve health, and we create, champion, and implement policies, plans, and laws that impact health. Here is a map of Washtenaw County residents that have confirmed or probable have been confirmed or are probable for COVID-19 by zip code. And this is through March 2020 through September 2nd, 2021. And we know that COVID has exposed existing health inequities. And we know from looking at this map that our most impacted areas are on the eastern side of the county. We also think this is a reflection of a long-term underinvestment in public health, and COVID certainly has been the largest health challenge in generations, and it exposed existing inequities that have been in place for many years.
Jimena, sorry to interrupt, but was that showing that the highest percentage was actually in 48104?
Yeah, it is the highest percentage, although that is mostly driven by University of Michigan.
Okay.
But there's also 48187, and I'm not arguing with.
Oh yeah, 48187.
Sorry, with the devastation that happened on the east side of the county, and that is on the east side of the county. That's it.
Yes. Yeah. In addition, we can also see that there is a disparate impact, particularly when it comes to the most serious illness, hospitalization, and death among communities of color. African Americans are overrepresented in not only in cases, but also in hospitalizations and deaths. As you can see from this sort of summary that is up to date through 9/30, showing the percentage of cases by racial and ethnic populations, as well as those who have been hospitalized, the number of deaths that we have had as representative of the percentage of their population. So this diagram or this graphic is from a National Academy of Medicine report that talked about the public health COVID-19 challenges that have been experienced across the country, both at a national level and a local level. And we know that there have been challenges locally and for our health department within all of these areas. We've had challenges in ensuring that information is quickly available and accessible for all communities and all populations, and getting resources out quickly, whether it was related to testing or vaccinations. But we also have learned along the way, and we've been able to make changes as the pandemic has rolled on. We have hired more community health workers. We have partnered more closely with community organizations that are rooted in communities. And we have done more to co-host information sessions in multiple languages, as well as continuing to offer vaccination clinics, pop-up testing events, flu vaccine, and more. We also have experienced challenges in planning. Of course, the pandemic is an emergency, and sometimes it's hard to plan for all emergencies, but this is what public health typically is planning for on a regular basis. And we found ourselves having to reassign all of our staff to support COVID response, and that still wasn't enough. We were dealing with funding that was coming at sort of uneven times and not in a timely manner. And it was very difficult to really plan ahead as we were responding and waiting for more resources. And so as we look and talk more about this proposal, that is one of the things that we really want to address. We want to ensure that we are doing everything we can to have real-time data so that we can respond proactively and we can plan for changes that are coming and that we already see are impacting our communities, like climate change. We also had challenges with various levels of government and decision-making. We had to deal with our state health department. We had to deal with our federal government and their response. And we often found, for example, in the vaccine rollout, that we were challenged by priorities that were put upon us or guidelines that were put upon us by the state that weren't necessarily implemented in a way to maximize equitable access. So in terms of our COVID response, here's a quote from a staff member when we did a survey kind of halfway through our response. And the staff person said, "We need more staffing and resources to build capacity for outbreaks like COVID-19, but also to address disparities that are being highlighted now. We've been working on identifying and addressing these inequities with limited resources for years." So as we are more than 19 months now into the pandemic, our roles have shifted somewhat, but we continue to be working mostly on COVID response, whether that's sharing updated information, facilitating access to testing, providing vaccinations. Our drive-through booster vaccine clinic just started. And happy to see lots of people coming through. We had 260 on the first day. Data and surveillance is ongoing, as well as case investigation and contact tracing. Those are all key parts of our COVID response and continue to this day. As we look at the elements of what I'm proposing in this plan to invest in our health and well-being, there are 4 main buckets that you'll see, and we'll talk about each of those a little bit more. One is leading with data, really ensuring that all we do is using that equity that's in the center of the wheel, that is our compass, that we focus on ongoing community engagement, partnerships, and that we not only are using data, but we're making that data accessible to all members of our community. The other bucket is healthy together. So really looking at what we can do to improve health at the individual level, at the community and neighborhood level. Focusing and strengthening our emergency preparedness capacity, as well as looking at the environmental justice issues that we are currently faced with and that we'll be faced with in the future, whether that's providing technical support, whether it's doing more ourselves around vector surveillance and addressing contamination, and preparing for climate change response. And then finally, ensuring that we are an equity-driven health department, that we have a health department that is accessible and welcoming to all, that we have a diverse public health workforce that is well-trained and prepared, and that we work as much as possible with not only our health systems, but our academic institutions to shore up our public health system. So starting with that first area, leading with data for equity, our approach will be to prioritize geographic areas and populations using the Opportunity Index as well as the Social Vulnerability Index. By using these tools, we can identify areas in our county that have very low or low opportunity and high social vulnerability. And that will be the priority for services and for the focus of this proposal. We also want to establish a framework of investment, whether that be funding or services, that we focus 75% of those resources in those areas that have very low or low opportunity and high social vulnerability. We also, as I mentioned, want to ensure that we are engaging with community members, community leaders, community stakeholders throughout the process, so that we are identifying together what are the most important community health priorities, and that we're working with community-driven and community-developed solutions and strategies. We also want to really move towards supporting a health in all policies through collective advocacy, along with our community partners and our county, so that we can really develop a collaborative approach that integrates and articulates health considerations into policy making across sectors to improve the health of communities for all people. This is a picture of our new RV, which hopefully many of you have seen. One of the first areas that we want to start with is what we're calling healthy people and healthy neighborhoods. We purchased this RV in a couple of months ago, but it's been primarily used for vaccine outreach, which has been great. We see it as a really important tool in making public health services more accessible throughout the county. We want to increase the use of this RV and have more staff that will be available to provide services. Services would include things like immunizations, sexual health services, lead testing, WIC, and insurance enrollment. In addition, we want to establish a network of community health workers. So looking at healthy neighborhoods, how we can embed community health workers into our neighborhoods, particularly in those areas that are prioritized because of low opportunity or high social vulnerability. Community health workers are trusted members of local communities who share lived experiences with their neighbors and peers, and they serve as a critical link between clinical and community-based services for the people who need them most. So CHWs are a critical bridge for communities and connecting them to systems of care. And given what we have been through with COVID-19 and the impacts and the long-lasting impacts of COVID-19, it's more important than ever. And really focusing on chronic disease prevention and building, strengthening resiliency in our communities. The other area is healthy homes and healthy places. So this really focuses on the environmental and health hazards that many people experience in their homes, whether that be lead, failing septic systems, or even things like preventing falls among our older adults. We want to build a network of community health workers that can help neighborhoods and communities and improve the health for people who are living in their homes. In addition, we have some key programs that really are it's important that we ensure that everyone who's eligible knows about these programs and has an opportunity to get enlisted in these services, whether that's children's special health care services or maternal infant health program, which is our home visiting program. We also want to strengthen our housing complaint process so that we can have more resources to respond rather than just mediate some issues related to housing or poor housing conditions, really have the ability to respond directly and also from a policy perspective. And then finally, we want to bring back a program that we had that was very successful, where we gave community grants to neighborhoods and organizations so that they could provide structural changes that would enhance public health or the health of their residents. So for example, we had projects that worked on building walking paths, that built or improved parks so that people will have safe places to exercise and play. We know that there are many environmental health issues that the health department is currently working on with really no additional resources. We continue to spend time addressing the Gelman plume, working on PFAS and vapor intrusion. And that work, I fear, will only continue and expand. We also know that climate change is impacting our communities and particularly our highest need neighborhoods. We want to ensure that we are prepared to respond from a public health perspective to issues around climate change, and that we can help our residents be as prepared as possible and have resources that are accessible. We also want to look at models that have been proven to be effective, like the CDC's BRACE model for climate change. And of course, we want to collaborate with the county on their climate action planning. In addition, we really want to focus on strengthening our emergency preparedness focus and ensuring that principles of equity and social justice are incorporated into emergency preparedness. And as we look to our health department, we want to build and strengthen our workforce. We want to ensure that we have a diverse workforce that represents the communities that we serve. And as I mentioned, we want to work more closely with our academic institutions, not only to support us in developing and strengthening that public health workforce pipeline, but really thinking about opportunities for participatory research where we can do work together with the community and really measure the impacts that we're having when it comes to improving health outcomes. Finally, our health department facility needs some investment as well. We have a building that is not ADA accessible, and we are working to improve that, but we cannot do it without additional investments. We want to ensure that everyone has access to all services in the health department and in our facility. We also want to increase the culturally and linguistically signage and wayfinding that we have in our buildings, and particularly in our health department clinic area. So this is another area where we want to ensure that our health department, our facilities are welcoming to all. So I wanted to give a few examples of some of the work that this proposal would support. So first of all, I wanted to just talk a little bit about WIC and the importance that WIC has. WIC, our program, has actually seen a pretty significant increase during COVID, but we know that not everyone who is eligible participates. Participation in SNAP, WIC, and also some of the tax credit programs like the child tax credit and earned income tax credit program are associated with a reduction in low birth weight and improvements in child educational achievement. So thinking about how we can, in that assurance role, develop a way to connect people to these services that might be eligible for them, ensure that they know that they're available, and really using those community health workers, that network of community health workers, to help build those connections and ensure that we are, as much as possible, enrolling everyone who is eligible into this program. Another example is related to the sale of menthol tobacco products. And we just had a meeting about this recently, and I'm sure we'll be sharing more information. But we know that, again, tobacco has a disparate impact on particularly our African-American residents. Menthol makes tobacco products more addictive and harder to quit. In an African-American tobacco study in Michigan, 63% of respondents started smoking with menthols. Nearly 65% of young small smokers say they would quit if menthol cigarettes were banned. So what if we, as the health department, as community leaders and stakeholders, could look and move the needle on policies that would limit or ban the availability of menthol and other flavored tobacco products? And then finally, I mentioned building healthy places. Here, we're really looking at a way to create lasting change and look at how we can invest in projects that support our local farmers markets, that improve access to healthy foods, that improve walking paths and ability to exercise and have physical activity, as well as looking to ensure that we have access to safe drinking water. So these are things that we would really focus on when we look at building healthy places and give resources to neighborhoods and community members to do projects that are their priorities. So I will emphasize that there's a need for long-term investment in public health. We cannot change or improve health outcomes without a long-term investment. What I'm proposing in this presentation really reflects not only supporting some of our continuing work, but expanding our services. To the extent possible, we will leverage other resources for these efforts, including insurance, state funding through our cost reimbursement agreement, federal funds through Medicaid outreach, and other potential grant resources. But ultimately, we cannot do this work without additional investment in public health. The county funds the health department at a base amount established 28 years ago, with a slight increase initiated recently. At the same time, the health department reimburses the county for central services at a near real-time expense. The inequity of this modeling puts enhanced pressures on the department's ability to meet ongoing need. Spending in public health is at a permanent resident rate of $3.75. I would also like to include that while this proposal does not specifically address COVID, we know that COVID-19 response is an ongoing need. And as much as I wish I could say that we were done with that work, clearly we're not. And now we are anticipating the approval of vaccinations for 5 to 11-year-olds. So we know that we have more work ahead of us. And I want to thank the Board of Commissioners for the additional allocation that was approved of $1.5 million to support public health COVID-19 response efforts. And as we have learned more about other funding availability, whether it be through FEMA, whether it be additional funding resources through the Michigan Department of Health and Human Services, we may come to the end of the year and have unexpended funds in that $1.5 million. And I would like the Board of Commissioners to consider rolling over any unexpended funds into the next year to continue supporting our COVID-19 response. So in closing, just again, highlighting that we really have not had a significant increase in county funding for public health since 1992. We appreciate the need to to adopt new initiatives, to start new initiatives. But many of those over the last years have been primarily grant funded, and that's limiting in a number of ways. So with our Washtenaw Rescue Plan request, we're really looking at structural one-time changes to our building, or one-time expense that would result in changes to our building to make it more accessible and welcoming to all. An ongoing investment in the community to address health inequities through assessment, assurance, and policy development. Expanded capacity across key areas that I mentioned and have reviewed with you, and also a strengthened public health workforce. And then, of course, continuing an ongoing commitment to engagement, partnership, and health equity. So that concludes my presentation. I want to thank all of you for your time and attention, and I'm happy to answer questions. Thank you.
Great. Thank you, Jimena, for that thorough presentation. Very much appreciate it. I will look for questions and comments from my colleagues. I see Commissioner Scott has raised a hand, and then Commissioner Labar will be after.
Thank you, Chair. Thank you, Director Lovelock. The presentation, I feel like, did a good job elucidating to us like some of the things that public health could do with increased funding. I appreciate your look back at the COVID response too, and to look at like where we had gaps and where we tried to fill in gaps. You know, I think that the public health department received some criticism for some of those gaps to begin with. And that's, you know, criticism, it can be helpful because it can help us grow. But it also, that COVID response and what was happening in COVID, it was so new and so quick. I mean, just if I could ask my colleagues and anybody watching the meeting to think about what you were doing the day before a lockdown was called, and then how life changed entirely, and how we saw hospital numbers change almost immediately that next day or that next week. It was so immediate and so quick and so unprecedented in this day and age that we didn't really understand all of the implications for what was happening. Even when you look at the debate that we have now on treating people with ivermectin, that came from that initial surge of COVID last March, because there were some initial, like, nobody knew how to treat it. And somebody was like, what about ivermectin? And maybe people were like, okay, maybe that'll work. I mean, since then, we've found studies that have shown that that doesn't work. And some of the studies that showed it might work may have actually been fabricated, but that's another story. But it's just, you know, at the point is at the point this was happening to us, it was so new. And I think that you guys did a good job in trying to address it, and then be open to the criticisms that people said, like, look, we got to get more outreach into these communities and help. I think I appreciate that. I feel like you listened to people on this board and listened to people in the community on how to get out more COVID vaccine response to those communities. The COVID disparity in what happened to people of color in our county was not about your response or lack of response. It was about long-standing social inequities in this country, because that happened everywhere in the United States, not just here. And so I'm hopeful, I keep saying this, with like public health funding, we can lower that. We can't change the racism that's everywhere in this country that people of color have experienced for generations, but we can mitigate it and make it better. And I think that your proposal showed that. I'm very excited by the proposal about community health workers. There are global examples of this working. The examples and the success is well documented by using people in the community, people trusted in the community. You could, if anybody wants to read about a global example of this, a great example is the lady health workers in Pakistan. And it changes a health system. It's a really economical way to bridge people getting into health systems and screening for things ahead of time. So I love the idea of strengthening a community health worker. The WIC program is a proven program. I don't know if I ever sent you my policy memo I wrote on that, Jimena, but expanding our WIC hours and expanding our WIC locations for people, I think also can help us. I want to note that we have a great school of public health here in Washtenaw County. And there's an article I really want to share with the Board of Commissioners that was written by Dr. Fleming, Maren Spolin, Bill Lopez, who are all here at the university, and Sandro Galea, who I think is in Boston. Just bear with me while I tell you the opening part of this article where they talk about the public health funding progress and how if we don't fund public health, it impedes public health progress. They write, deeply entrenched health inequities are well documented across the United States. These inequities are being laid bare by the coronavirus disease, COVID-19 pandemic, and the protests of police violence against Black people in the United States, including the extrajudicial killings of George Floyd and Breonna Taylor. Health inequities stem in large part from government policies and practices that distribute power and resources, such as housing, law enforcement, education, employment, environmental amenities, and health services inequitably. Simultaneously, our government-funded public health agencies are tasked with eliminating the resulting health inequities and improving public population health. Thus, public health finds itself in a paradox. The government and taxpayers are subsidizing both policies that cause health inequities and the work by public health agencies to address them. I mean, this is what we're talking about tonight here. I mean, I don't have a lot of questions for you, Jimena, just maybe asking colleagues to really think about what we're talking about. We're talking about the budget coming up. And how do we approve certain things in the budget and go forward, knowing that they cause more of these inequities, and then deny more funding to public health who are asking to help us mitigate these inequities or help with these inequities. And so I personally, I think this is a great proposal. I think it is morally puts us on the map in the budget for putting our money where our values are. And we have done a lot of talking as a Board of Commissioners about wanting to make sure that we see things distributed equitably with the ARPA funds, but we can talk about distributing things with equity in the budget that we're coming up to approve as well. And I think this is part of it. Like the ARPA funds, yes, but nobody's said, like, think about the budget for this year. This is it right here. This is one of the ways we can do it. I think you've got some really good laid out plans, and you are going to be able to show us the results of those things with the ideas that you have here. So thank you very much. Everyone, I will send you this article. Anybody who's watching, I think maybe, I don't know if there's anybody, but anybody who wants to read the article, I'm sure that the authors who work at the university would be happy to send it to you too. Thank you. Thank you, Chair.
Thank you, Commissioner. Commissioner LaBarre.
Thanks, Chair. Hey, man, I really appreciate the presentation. I know you put a lot of work into it, you and your staff, and I think it's very responsive to some of the discussions we've had at this board table, particularly the last year and a half. I think this is, I think this is not just an effort worth doing and funding, but I think if we move forward with this plan, it will be for this board and for this organization sort of a pivot point in terms of greater structural investment in public health. And I think there's any number of reasons to do that, but adhering to the emergency declaration that we passed back last summer, summer of 2020, the combined initial reaction to COVID and the likelihood of having to plan for its lasting impacts And I think also just the greater recognition within the organization about the roles, that economic and public health data can play in terms of impacting the other. As we've seen greater awareness of that, I think we've got to match resource and bring resources to bear to impact that. I think this is a really good start to do that. And so I very much appreciate the development of this plan. And I'm hopeful that this, for the 9 of us, hits that spot that we all talked about in terms of wanting to do more on public health, and maybe not getting into the issue of new revenue. So I'm excited about what we have here, and look forward to hopefully taking action on this next year.
Thank you, Commissioner Morgan.
Thank you, Chair. Thank you, Jimena. I know this is coming to us after many, many conversations, to which I think all of us have concluded that we need to better invest in public health and our public health department. I know a lot of that conversation started when we were talking about the idea of new revenue, and some folks were, I think, rightfully worried about the impact of new taxes at this time. But I think that there are resources to bear at the county through the rescue plan that I think you've laid out a pretty excellent plan for how we could utilize those funds, really focused on community building, on community health, on equity, and on the things that, I feel like I'm hearing from residents that are needs, directly engaging with community organizations and supporting a health and all policies sort of, approach that I know is very important in our public health department. And I know that your department in particular is very in tune to the health equity data and very concerned about reducing our health inequities throughout the county. So, I really like what you've laid out. I really like that you're thinking comprehensively, because certainly I won't tell you what we need for public health as you're the expert here, but I think we know that looking at the overall comprehensive health of a person is so critically important. Looking at environmental concerns, food access, COVID, of course, the disease prevention, smoking. If I could outlaw smoking completely, I would, as somebody who has had 2 grandfathers pass away from lung cancer. I think we need to do everything at our disposal to reduce the number of people smoking any sort of tobacco in our community. I have less different opinions on other things, but tobacco, I think, is something that is extremely detrimental. I do have one question, and it is around the amounts that you had mentioned in the PowerPoint here. Is there, and maybe that's provided in the other documents and I missed it, but I'm curious about where you get the sort of 1.3, 2.5, 2.8, the different amounts, and if there's any easy or quick answer to that.
Thank you, Commissioner Morgan. I worked with our finance director to, as we planned these different initiatives and areas, to map out what we would need from a budget perspective, and we sort of broke it out on an annual basis. So I'm happy to share more detail, and I can certainly share that information with everyone, but that is based on our projections of what we would need in order to carry out these various initiatives. And that does include additional staff capacity for the health department.
Okay, great. Well, and I actually like that you've laid out those numbers, because what that tells me is that you're not just saying, hey, give us 2.5 million each year. You're saying, here are our specific needs. And I certainly trust you as to sort of the details behind those numbers. So I like that you've laid out those numbers for us and that you have a thoughtful plan for that. I think the other question I have was around, I believe you mentioned investing or partnering with community organizations. And I'm wondering if you could tell us more about that. Is it through grants or what kind of organizations is this?
Sure. And also just going back to your previous question, I should also mention that the amounts are different in different years because not everything would get implemented all at once. So there is a little bit of, some planning that would happen before actual implementation. And I tried to indicate that in my presentation on the slides. In terms of the work with community organizations, so we have one area, the Building Healthy Places, where we are proposing a smaller community grant program. Again, it's similar to a program that we had previously that ended. So those would be community grants available to organizations, neighborhoods, local government as well. We had some, for example, we had some townships that got grants to do improvements in their neighborhoods. But the other thing is, in general, our work, when I talk about community engagement and I talk about our assurance role, so much of that work is really in partnership with community organizations, with other healthcare providers, with other cross-sector partners. And I think that, I think Commissioner Scott often is the one who says everything is public health, right? And so certainly there's a public health connection in so much of our work across the county in various sectors. We can't and don't need to do everything. But what we can do as a health department and as leaders in public health is we can convene, we can collaborate, and we can work in partnership to ensure that we're doing everything possible to address health inequities, to improve health outcomes, and really work together on community identified health priorities. So we have a lot of partners that we currently work with, but that is not an exhaustive group. I think there's always opportunities to build new partnerships and look across sectors to be innovative in those partnerships as well.
Got it. I think that sounds wonderful. I think, this is something that to me, I think I'm generally supportive of, would want to sort of hear some public feedback or, what folks in the public think about whether they believe we should invest in public health. I certainly, I think we should, and I think we should in these areas that you've outlined, but I would certainly be curious to hear from the public as we consider this, among other things, for utilization of rescue plan dollars. The only sort of ask I guess I would make would be that if there are opportunities to kind of partner closely with the board or with us as commissioners to kind of get out there and see some of this work sometime, I think that would be helpful. I think it was mentioned by perhaps Commissioner Scott or someone last night about how the work of public health, the really amazing work of public health, is absolutely part of the work of the county as a whole. I think sometimes people forget that, if public health is doing community outreach or neighborhood outreach or partnering with organizations or giving out grants, I think sometimes people forget that that is part of county government. Like we're all one team, we're all working together here, but they sometimes say, well, that's great. Public health gave us money or talked to us or reached out, but the board didn't do anything. And my answer to that is no, we're all together here. We're all a team. We rely very heavily on our staff because they're, one, the experts, two, absolutely amazing, and three, we just can't be everywhere. But wherever there are some opportunities for us to be part of that great work, please let us know. I know a lot of us would always welcome the opportunity to be a little more hands-on whenever we are not in the way without causing trouble or slowing down the great work happening. But I think that would be helpful to all of us as a whole as we look at how we can build support and build community support for us to invest in public health. Thank you very much, Chair. And thank you so much, Jimena.
I appreciate that, Commissioner Morgan. And if anyone wants to volunteer or just stop by our drive-through vaccine clinic, it's going on all month. So let me know if you want to come by. Our staff and volunteers would really be happy to see any of you and all of you.
All right, thank you. I think next we have Commissioner Sanders, and then I think Commissioner Schenk.
You're muted.
Yeah, Commissioner Sanders, I think you're muted.
So good evening. I had maybe two questions, I think. One isn't a question, it's a request. I would be interested in seeing the current list of your community partners that you mentioned. I would be interested in seeing that or having it shared with commissioners if they're so interested. And I think you spoke before, maybe 2 months ago, about outreach to the community. You didn't say listening tour, but that came up in this conversation. So I'm wondering, when is that supposed to occur? When is there supposed to be outreach to the community about their thoughts, feelings, experiences with the health department? Because I think the last time we mentioned it, I specifically wanted to know when that was going to occur. And so now it's coming up again. And I don't know, and I need you to tell me, is that something contingent on your budget approval, or can that be done regardless of whether or not you get the budget? And when will we do that? Because I think that the public should be able to inform in partnership with their data how they are served, because the health officers, our public health workers, they are experts in their fields, but people are also experts about what they need. So I'd like to know, when is there going to be some effort to get that information and have some marriage between the data and the real life boots on the ground? We think this and we're not getting this. We want this.
Thanks for your question, Commissioner Sanders. So our plan is to really take the first 6 months of this time frame that we're proposing for that kind of community engagement. And I think that it will also be ongoing. So we want to have an initial period where we're able to do more of that kind of listening tour, more of those town hall, whatever kind of various forms, right, to get feedback and input and hear people's perspectives. So our plan is to really do a lot of that in the initial 6 months. But again, as I mentioned, really the community engagement piece, we want that to be built in throughout the whole plan. And so in some shape or form, really thinking about how that can be done in an ongoing manner. So for example, if we have a 6-month planning period, we're working with a particular area or neighborhood of the county, and they identify through this process, some particular priorities that they want us to focus on in partnership with them. Then how do we continue that relationship and that feedback and engagement mechanism so that we can evaluate not only what we're doing in terms of looking at data and changes and outcomes, but we can evaluate how we're doing in terms of our work as a health department, how we're doing in terms of our partnerships, and whether there are partnerships that need to be expanded or new partnerships that need to be developed. So I think that we want to take an initial period, like I said, of 6 months, but again, really build that in as an ongoing process. And the other thing I just wanted to mention also in terms of, I talked a little bit about the partnership with our academic institutions. There are some health departments that adopt what's called an academic health department model. And I'm not necessarily sure that that's what we're going to end up doing. But part of that is really building closer ties to academic institutions, not only to support public health workforce, but to really support research and evaluation. And so my hope also is that through those partnerships, we'll also be able to build our capacity to evaluate our services, to evaluate our work, not just when it comes to looking at community health outcome data, but really looking at how we are doing in terms of being responsive to the community, addressing community community priorities that are identified. And so I think that's also part of what we want to build our capacity to do by strengthening those partnerships with our academic institutions as well. And then finally, I just want to give a thank you to our racial equity officer, Elise Asbury Payne, who I shared this proposal with her. We had some conversation about it, and she provided some really good feedback. And I anticipate that we'll continue to talk and as this gets finalized and further fleshed out. Thank you.
Okay, next up we have Commissioner Schenk and then Commissioner Hodge.
Thank you for your detailed presentation, and I will be diving deeper, so probably coming back to you with more questions going forward. And I just want to relay that I talked with Ken Dignan, the supervisor of Northfield Township, about some of the things that you talked about in your presentation, and he was excited. I know in Northfield Township, really more in Whitmore Lake area, that there's a real desire for more access to medical services because there are a lot of people who just aren't going to travel to get help. And so I think anything that we can do toward accomplishing that would be a huge accomplishment and really appreciated by the community. And I know that you're connected and working within Northfield Township too. So I really appreciate that. I just wanted to relay that.
Thank you, Commissioner. Commissioner Hodge.
Thank you, Chair. Thank you, Jimena, for the presentation. I really like how it all fits together and how you structure the different components of it. I particularly like the whole, leaning into the healthy together branding and coming up with the different categories of healthy people, homes, neighborhoods, places. I wanted to ask a couple of questions specifically about the healthy people and neighborhoods piece of it, since I think that's the part that I'm most excited about, since it includes the community health workers piece and then expansion of the work that the RV is doing. Commissioner Scott talked a lot about community health workers already. I would just want to add that when we look at the health disparities in the county, I see community health workers and the use of the RV or other mobile services is one of our best tools to, take care of those disparities. So just digging into that a little bit more, I know we already have a system of community health workers. Could you talk about some of the positive effects we've seen from their work and then where we would look to deploy more health workers and then what we could expect?
Sure. So Commissioner Hodge, I think with the community health workers, we have community health workers that work at the health department, and then we also have community health workers that work at the Washtenaw Health Plan. And those community health workers often work together. So for the health plan, for example, community health workers are really instrumental in enrolling in doing outreach and enrolling people who are eligible into all kinds of benefits, not just the Washtenaw Health Plan, but Medicaid and other benefits that they may be eligible for. And so when I talked about insurance enrollment as part of the services that could be offered through the RV, we would be able to use community health workers to help expand the ability to provide that kind of enrollment assistance. And the key, as I mentioned with community health workers, is that they are from the neighborhood. They are trusted. They are able to connect with their fellow residents and really provide information in an accessible manner and help make those key connections. Because it's not enough to just, give someone information or just give them a referral source. A lot of times what's essential is the work that happens within that relationship and how that can increase accessibility and connection to needed services. The other example I'll share is the community health workers who are helping us with vaccine outreach. They have done a tremendous job looking at data around vaccination rates, identifying areas where we have lower vaccination rates, and doing outreach, canvassing neighborhoods, sharing information and education about COVID-19 vaccination, using the RV to also help kind of establish a presence there and provide those vaccinations. And we've gone from, I think in May, we had, I want to say we had just under 50% of our census tracts at 70% vaccination rate. And now we're at close to 70% of our census tracts at 70% vaccination rate. So they've made a tremendous impact. And of course, these services are delivered in multiple languages. And so again, the accessibility is really key.
So the other piece that I really like about that model is that we're hiring people that are in the neighborhood. So like you said, they're trusted within the neighborhood. So that helps us from an economic perspective and then from that public health perspective, since, you know, it's not a surprise that there's a lot of overlap between economic disparity and then the health outcome disparities. Cool. So then with the RV is already in use now. And I've been at a couple of events with it. It's great. I still haven't had a chance to ride in it yet. And you know how I feel about that. So I'm looking forward to doing that at some point. With the additional funding, what more would the RV be able to do? Like, I don't know how many days per week it's out on the road, but how many days per week would it be on the road with more funding?
So another good question. And I think that probably is something that I can't say exactly how many days it would be out on the road, but there are two key things. One is that we would use the data that I talked about related to the opportunity index and the social vulnerability index to determine the areas, the kind of priority areas that we would want to ensure that the van or the RV is going to. In addition, I think through the community engagement process, we may offer different services in different areas depending on what are the biggest priorities or what's the greatest need. So it may not be the same all the time, but what this funding would allow us to do is not only implement the RV more widely throughout the county, but also have a team of staff that could provide those services. So we're not pulling staff that are currently working in our clinics already, but we're able to add capacity so that RV can be out there more. So we have a nurse, we have a nurse practitioner, we have a community health worker, we have a health educator that can really be part and dedicated to supporting that RV so it can be more present and available more days throughout the county.
Cool. Last question I have for now, unless I think of more. The piece about, I want to really underscore that some of the facilities not being ADA compliant. Like we've talked about that a bit over time. Just want to underscore that that's not good. Like that's a pretty serious problem, and we need to take some action on it. And that's a one-time cost, right? We make it compliant, we're good to go at that point.
Correct.
Yeah. So just want to throw that out there. There's not a question there. Cool. Thank you.
You're welcome.
All right. Looking for anybody else that might have questions. Commissioner Beeman.
Thank you, Jimena, for that wonderful presentation and all the work that you and your team have put into it. I also love the RV. I didn't know we could go for rides in it. And it's been in my community and greatly appreciated in terms of vaccinations that we're doing right now. I too am, very concerned about the inequities and the things that we've seen on the eastern side of the county. And I'm also concerned about the reduction in care we're seeing on the west side of the county, just as our rural doctors retire and our pharmacies are closing and that sort of thing. So I don't want to pull away from the importance of the eastern side, but wondering in this plan if there's a way to kind of be proactive versus reactive. Not that we've had a lot of time to do that with COVID. We've had to be very reactionary, but just kind of wanted to hear your thoughts on that.
Thanks, Commissioner Beeman. Certainly, if we look at the Opportunity Index and the Social Vulnerability Index, we find some areas on the western side of the county that have both low opportunity and high social vulnerability. And so that's certainly something that we would be looking at as we identify those areas. I think the other thing is, again, going back to what I talked about in terms of that assurance role, that we don't necessarily have to be the ones to provide all the services, but again, we can do a lot in terms of bringing partners together, looking at how to ensure that resources are available and that healthcare services are available. So that's part of what we do in our assurance role. And again, I think that with expanded capacity, we will be able to do more of that, to really kind of not only look at healthcare, but look at other services, accessibility to other services, and how we can be that convener that can work to increase access and availability of services. And again, I think with the community engagement piece, really working with our stakeholders, our community members and community partners to identify what are those priority areas so that we're not just focused on everything under the sun, but really looking at data based and then basing it on other feedback and engagement information we're getting from community engagement. What are like the top, 3 issues that we really need to focus on, and how can we work to address those?
Thank you.
I hope that answered your question.
Looks like it. Looking for any other comments, questions? Commissioner Jefferson.
Thank you, Chair. Good evening, Hamida. The presentation was something that I think has a lot of information, but also it reminds me of the factors that bring us to these points of needs in health equity. That is, we need more activity programs for our youth, for our elderly, physical activities. We need more food and those type of things within our community. That nutrition can be a factor in their health. And also we need to have less stress when it comes to, there's this gap in education, income, jobs, and those type of things that are causing these stressors, which is a big influence on health as far as those who are pregnant, those who are experiencing health, high hypertension and those type of things. So I know it's a lot of things that contribute to health problems that are, possibly in need of resources and funding also. So those type of things that are preventive is more what I'm asking about, is those type of things that you're speaking of tonight. That what is it that could be said that this ask would give us some more idea of what public health can do realistically to prevent some of these health problems that we're dealing with, and the way that they're evaluated. I mean, is there something that you can show us maybe in the future about the things that are on the list of things that continuously come to public health as a problem that have not been really addressed to make a difference, and those type of things. So, I mean, the efficiency is another thing that I'm thinking about. I mean, I don't know what type of efficiency of funding use is happening there either. Whether there's some things that have been, I guess, targeted, but maybe should been targeted somewhere else or some other way, of those type of things. So I have a lot of questions about those things too. Just start throw those out. You don't really have to answer if you don't have anything.
Well, if it's all right, thank you, Commissioner Jefferson. There's just one thing that I would just highlight, which is we really have not been able, because of lack of resources, to do a lot of work focusing on chronic disease prevention. And I'm glad you mentioned prevention, because that is really what public health focuses on. And I was listening to someone in CDC talk about chronic disease prevention, and they were talking about the key areas that public health needs to focus on in order to make the biggest gains when it comes to chronic disease prevention. And they are food and nutrition security, the built environment, tobacco policy, social connectedness, and clinical community linkages. And so if you think about the proposal, we talk about a lot of those different areas. Community health workers can play a key role in helping address chronic disease prevention, linking people to screenings and other kinds of services. We have a prescription for health program also that uses community health workers. I failed to mention that one. That's a great program that links people to farmers markets to help them get more fresh fruits and vegetables into their diet, that provides nutrition education and counseling. Those are the kind of things that I think are needed more of. More of that is needed, more of that focus is needed. And in terms of the funding, I think one of the challenges that we have in public health is that so much of our funding is very specific and siloed. So when we have funding from the state for essential local public health services, we can only use it for those things. We don't have the flexibility. It's not like we can say, oh, we got $500,000, let's use it wherever it's needed. We don't have that flexibility. So much of it is prescriptive and has very specific requirements. So I think with additional investment, what we would get is not only additional public health capacity, but we might have more flexibility to do exactly what you're talking about, so that as we identify emerging needs, as we identify differing priorities, we're able to make those adjustments. Thank you.
Thank you for the response there. Looking for any other questions, comments, any other members of the board might have tonight? Commissioner Scott.
Thanks very much, Chair. I just wanted to pick up on what our Director Lovelock was saying and what Commissioner Hodge said, and then make a footnote about riding in the RV. I didn't know we were going to be able to ride in the RV either. I'm ready to take it out for a joyride. I nominate Caroline to drive. I just want to note the community health worker. I think one of the greatest things about the community health worker programs that work well is that they also define their role and the community defines their role. So sometimes you think that you might be using community health workers for a certain type of outreach, and the community says, this is not why we need you. We need you for this. And I think that being able to think that we're going to be flexible with that, and that goes then to Commissioner Sanders talking about letting the community say the services they need. So you get the community health workers and you make sure that the community health workers are tied into what the community actually needs. Again, I can reference this lady health workers in Pakistan, and they sent these workers out and said, what do you know about childbirth? And they were like, we don't do that. And they're like, then we don't need you. So they went back and retrained and then came back in to do work in the community with childbirth. And I have full faith that what would happen in this county would be similar. if we sent community health workers out to do certain work and focus on something, and the community said that's not what we need, then we use the community health workers and the community to help to find those things for us. And in terms of the RV that Caroline's going to drive when we go out for a joyride, I just want to note that this proposal that you've given to us also looks for more structural funding, and we need more structural funding to have workers to do the work. So to get people, because none of the work stops at the health department for the staff that's existing there. That work is only increasing along with everybody's work in healthcare. That work is only increasing. You need more staff to go out and do the work that would be done in the RV in the communities. And to do that, we need more structural funding. So it's kind of a catch-22. But when you think about the kind of aspects of health and healthcare, and in particular public health, you could argue a bunch of different levels are maybe the most important things, of leadership or healthcare workers. And I'm not even going to tell you as a healthcare worker that we're the most important. The most important thing, I think, is to provide the health system that you're asking to do the work with the financing to be able to do the work. Because you can't get the workers if you don't have the financing. So I think thinking about how we differentially, like how we fund the health department in a different way and give them more structural funds, I think impacts our community. And I'm excited about the proposal. Thank you, Chair.
Thank you. Anybody else have any comments, questions this evening? One of the things about sharing the meeting is you get to go last, which means everybody else has asked really good questions. So I am very, very supportive and interested in the community health worker aspect of this as well. As somebody who used to run a program with almost 50 community health workers in it, would really hope that we can pursue that model and use that as a way to outreach to the community differently, approach people with resources in a different way, which is what we really need to do to help really get at the equity issues that we have and that you've talked about tonight. So very much appreciate the ability you have to target in on neighborhoods and communities with that RV and some of the other things. So very much appreciate that. With that, I want to thank you for coming in this evening with your presentation, and I really appreciated all the questions and comments tonight. I think it was a really good working session and a good discussion. I'm glad we had plenty of time to delve in on this one topic tonight. With that,
thank you. Thanks so much. And I just wanted to thank Diane and Greg also for their support throughout this process. So we've been exchanging ideas, and I've been sharing this proposal with them as well. So thank you to them both, and thank you, commissioners. Appreciate your time this evening. Great questions, great conversation. Thank you.
Thank you. With that, we will move on to items for current or future discussion. Seeing none, next item is pending items. Are there any pending items? Which I do not believe there are. Which takes us to adjournment.
So moved.
Support.
Adjournment is moved and supported. I will note that our next working session is on October 21st at 6:30. And with that, I guess all in favor of adjourning?
Aye.
Aye.
And anyone opposed? Hearing none, we are adjourned. Everyone have a good evening.
Good night.
Next working
Night.
session is the day before my birthday. I just want to point that out, friends. So, okay. All right. Thank you.
All right. Well,
right.
we'll look forward to your birthday.
49. All right. Bye, guys.
Good night, everyone.
Bye-bye.